This is Dr. Cook, and welcome to Catalyst Vet, where we help you understand what's going on with your precious pet. You are here today because your pet was diagnosed or suspected of being obese or overweight. But don't worry, many of us are actually in the same boat. Dogs just don't need as many calories as people do. And most importantly, we can increase our dog's life by up to 2 years by getting them to the appropriate and ideal body weight, while also decreasing systemic signs of inflammation and pain. So while fat may seem harmless, it's actually an organ that produces hormones that lead to insulin resistance and increase inflammation in the body, as well as increasing pressure on the joints and making arthritis worse. Causes and risk factors. Now, going over the daily needed calories is the main cause of obesity. There are other factors which may contribute, like hormonal diseases like Cushing's disease, hypothyroidism, breed and genetics can play a role, spay and neuter status, as well as concurrent orthopedic disease preventing your animal from moving around. And how was your pet diagnosed or suspected of having this disease? Usually in the history, there are no concerns. However, some owners may have noticed an inability to move around or lameness. The main way that we diagnose obesity, though, is through a WASAVA score. There is this really awesome scoring system made by WASAVA, which goes from 0 to 9. Anything 4 to 5 is considered ideal, 6 to 7 is considered overweight, and a body conditioning score of 8 and 9 is considered obese. For every single point above 4 or 5, it is considered about a 10% excess in body weight. This super cool chart can also be used as a reference for how your dog should look once you're trying to maintain a certain body weight as well. A link to this chart will be placed in the video description. So, in general, no laboratory tests need to be performed to diagnose obesity. However, if based on history and physical exam, it does seem like there may be contributing factors like hypothyroidism or Cushing's disease, your vet may encourage you to do further tests to rule those out. Prognosis and outcome. So, prognosis is the direction in which a disease is likely to go. For any pets that are able to correct their obesity, the prognosis is great. They can go on living a normal, healthy, and happy life. In fact, one study showed that a weight loss of anywhere from 6 to 8% can make a significant impact on the amount of pain your dog is feeling in their joints. Now, some factors that may affect the prognosis are the degree of arthritis that your pet has when they first started their weight loss journey, as well as comorbidities like heart disease, Cushing's disease, and hypothyroidism. Treatment and goal of treatment. The goal of treatment is to lose anywhere between 0.5 and 2% body fat per week. No more than that, because weight losses faster than that will end up causing lean mass to be lost in the form of muscle tissue that is metabolically active and that they need in order to support their joints and exercise. The main treatment that we're going to be using all around in order to get your pet to lose weight is going to be diet. Diet is the key factor here. It's going to make up 90% of what makes your dog have a successful weight loss journey. And for those diets, I want them to meet these criteria listed right here. They also need to meet the AFCO standards for maintenance. Some prescription diets may not meet the standard for maintenance, and so can only be fed for up to about 6 months. Down below, I will have a link that shows some of the diets that I recommend, both over-the-counter and prescription diets that may be used as a weight loss diet. Now, for those of you who are into math and are curious, I'm going to show you how we as veterinarians calculate how much your pet needs to lose and how many calories they should eat per day in order to reach that weight goal. Let's say we have a large breed dog that is a body conditioning score of 8 out of 9, who currently weighs 90 pounds. For this breed of dog, I'm going to say that its ideal body conditioning score should be a 5. For every 1 point above that 5, that's 10% excess body weight. So in this case, 30% extra body weight. Personally, I use this formula right here. I take the body weight, multiply it by 0.7 because they need to weigh 70% of what they weigh currently. So once we get their ideal weight in pounds, we divide that by 2.2 to get their weight in kilograms. Then I take that ideal body weight and I plug it into this formula. Ideal body weight to the power of 0.75 times 70. That gives us the resting energy requirements, or how many calories your dog burns just by laying around all day doing nothing. And to my surprise, and probably yours, that's actually the majority of calories that both we as humans and dogs burn anyways. So in this case, it would be roughly 866 calories daily. Now for me personally, if your dog is not doing a lot of exercise, I use that number right there as the calories they should eat per day. But some doctors may multiply that by a factor, anywhere from 1.2 to 1.6, depending on activity level, neuter status, etc. And another method that vets might do is just taking what your dog currently eats and only feeding them 80% of that in order to reach their ideal body weight. Now, it is important to remember that this is an estimate. Close monitoring needs to be done in order to make sure that your pet is losing weight too fast. If you're watching this video, please consult your veterinarian before starting a calorie-restricted diet, as you don't want to do it the wrong way. Medications and potential side effects. Diet actually makes up about 80 to 90% of what's going to cause a successful treatment in obesity. And this is for both people and animals. And luckily for us, diet is the one thing that you are in complete control of. Let me say that again. You are in complete control of the diet. Things you can't control include how much they want to exercise, or if they're even willing to exercise. If you're curious and wanted to calculate the resting energy requirements of your dog, you can actually use this website right here, which follows the guidelines based from the Ohio State University Center of Nutrition. Now, say your dog is spoiled and he's been eating home-cooked food for his or her whole life, then what I would do is go to balanceit. From there, you can plug in what kind of ingredients you are interested in feeding your dog. It'll put those together with the certain amounts, and it'll let you know what nutritional qualities may be deficient in that diet and things you could potentially add versus potentially one of their supplements to make things easier for you. One thing I do recommend very highly for anybody who has a dog is to consult with a board-certified veterinary nutritionist. Doing this one time in your life or for a couple of sessions can make all the difference in the world. They can help you set up a diet that is specific to the needs of your dog, the type of ingredients that you want, whether or not your dog has comorbidities or other diseases or not. And so it is much worth the investment for years of quality life and quality ingredients. Let's cover the elephant in the room. Treats. We all know that treats are a huge factor when it comes to bonding with our pets. It is a form of love. And if you're going to give treats, just make sure that they don't amount to any more than 10% of the overall calories in the diet. Otherwise, the diet might not be complete and balanced. But if your treats are going to be some sort of treat that is exactly the same as the diet, whether it's kibble or some sort of prescription bone or something like that, that's fine because that is complete and balanced. To my left and to my right are some of the fruits and vegetables that you can safely feed to a dog. They are high in water, high in fiber, high in micronutrients, lower in calories, and make great healthy treats. For a complete list of those types of fruits, you can check the links below. So I know I said that exercise does not do much, and you're going to say I'm backtracking here, but I'm not. That 10 to 20% that exercise can do may be somewhat significant. One, it helps them maintain their muscle mass. It keeps the joints healthy as long as you're not being excessive on it, and it can help burn that extra 10 to 20% of calories that your dog may need. However, the exercise plan needs to be tailored to your dog. If you have a young, healthy dog that does not have orthopedic disease and is not limping, sure, they can probably enjoy some moderate exercise. Just be careful with the length, intensity, and how hot it is outside. But if you have a dog that has severe arthritis, who is limping and having trouble getting up, then they are going to need to take it more slowly and step by step. And most importantly, they need to be on a plan to control that pain, whether that's including non-steroidal anti-inflammatories, supplements, or others. Here is a list of some of the most important things that I find help with regards to pain. I will be covering these in more depth in another video. And in severe cases where your dog is really in pain, it may be necessary to take them to a rehabilitation center where they can do things like an underwater treadmill, like this dog here, and other exercises at home that are going to help them regain that mobility, regain that health in their joints, and lose weight. Monitoring. Depending on your veterinarian, they may change this, but I recommend monitoring weight every 1 to 2 weeks in the beginning to make sure your pet is not losing weight too fast and not losing above that 2% body weight that is recommended. For small dogs, you can either buy a pediatric scale or you can go ahead and weigh yourself with your dog on a regular human scale and then subtract your weight from that total weight in order to get their weight. It may not be as accurate, but it's still good. For larger breed dogs, if you can pick them up, great, but if you can't, then go ahead and go to the vet, place them on the scale, and also have a consultation with your vet about the progress and if they need to change any of the calories. Now, for some dogs that are giant breed dogs or have severe arthritis and they can't even get in the car, then that's a different case. For those, we may need to have them come in longer frequencies, maybe every couple of weeks to once a month, as long as we see that they are not losing weight too fast. If weight loss is too fast or not fast enough, then please call your veterinarian and try to come up with a calorie plan that is adjusted to meet your needs. As a general rule of thumb, you can probably safely go up about 10% calories if losing weight too quickly, or down about 10% in calories if not losing weight fast enough, and continue to monitor their weight at least once a week. And lastly, just watch them as they start moving around more, they start acting like a puppy again, they're in less pain, and they feel better. And possibly enjoy that extra 2 years of life with such a precious animal. Further testing and recheck exams. So there may or may not need to be further tests, but a physical exam and monitoring for muscle score, body conditioning score should be done by your vet, as well as weight checks to make sure everything is going as planned. I prefer rechecks in the first 1 to 2 weeks, but it should go no longer than 1 month. Now, if you have any questions about this material, then please leave a comment below. Just know that I do not have a direct VCPR, veterinary client-patient relationship with you, so I may not be able to answer specific questions about your pet, but any questions about this material, what it means, and why things are done, I can answer for you in the comments below. Once again, thanks for joining Catalyst Vet, where we help you understand what's going on with your precious pet.